In this video, we are going to learn about rickettsial infections, the species causing them, and the vectors transmitting those diseases. So there are three main groups of rickettsial infections: typhus group, spotted fever group, and scrub typhus group. In the typhus group, we have Rickettsial prowazacii and Rickettsial typhi. The species Rickettsial prowazacii causes the disease epidemic typhus, and it is transmitted by the vector louse. And Rickettsial typhi causes endemic typhus, and it is transmitted by the vector flea. The way I remember this is, in the word Rickettsial prowazacii, there is P. P is the first letter of the word prowazacii. And then we have epidemic typhus. There is the letter P is also there. So that's how I remember Rickettsial prowazacii causes epidemic typhus. And Rickettsial typhi is transmitted by the vector flea. They both sound pretty similar. That's how I remember them. And they cause endemic typhus. So Rickettsial typhi, which is transmitted by the vector flea, causes endemic typhus. Okay, and epidemic typhus is caused by Rickettsial prowazacii, PP. Then we have the spotted fever group. There are three organisms here: Rickettsial rickettsii, Rickettsial connorii, and Rickettsial acari. The species Rickettsial rickettsii, they cause Rocky Mountain spotted fever, and they are transmitted by the vector heart tick. So there is the word rock in the name of the disease, Rocky Mountain spotted fever, and rocks are very hard. That's how I remember they are transmitted by heart ticks. And Rickettsial connorii, it causes Indian tick typhus or Mediterranean spotted fever, and they are also transmitted by heart tick. In the name connorii, there are three letters: NRI, connorii, NRI. NRI is non-resident Indian, so we can derive Indian tick typhus from that. And then of all the diseases here, only the diseases caused by Rickettsial connorii, they have the names of countries or regions. So that's how we remember Indian tick typhus and Mediterranean spotted fever. Then we have Rickettsial acari, which causes rickettsial pox, and it is transmitted by mite. Please don't get confused here. Rickettsial rickettsii and Rickettsial connorii are transmitted by heart tick, and Rickettsial acari is transmitted by mite. Then lastly, we have scrub typhus group, which is Orientia tsutsugamushi, which causes the disease scrub typhus, and it is also transmitted by mite. So, louse transmits epidemic typhus caused by Rickettsial prowazacii. Flea transmits endemic typhus caused by Rickettsial typhi. Heart ticks, they transmit Rocky Mountain spotted fever caused by Rickettsial rickettsii, and Indian tick typhus or Mediterranean spotted fever caused by Rickettsial connorii. And mites transmit rickettsial pox by Rickettsial acari, and scrub typhus by Orientia tsutsugamushi. Moving on to the clinical manifestations of rickettsial infections. We have symptoms like fever, headache, myalgia, and rash, which is very important. There is slight difference in the presentation of rash between the typhus group of diseases and the Rocky Mountain spotted fever. In the typhus group of rickettsial infections, the rash starts centrally and then spreads out, and it will also not involve the palms and soles. Okay, it spares palms and soles. So you can remember this by typhus and trunk, T and T. Then we have Rocky Mountain spotted fever, which starts at the wrists and ankles and then spreads to the trunk, and it also involves the palms and soles. You can remember this as Rocky Mountain spotted fever starts from the wrists, R and R in both the words. So all the diseases which involve palms and soles, the rashes involving palms and soles, you can remember this by the mnemonic CARS. Here CA stands for Coxsackie virus A infection, which causes hand, foot, mouth disease. You don't really need a mnemonic to remember this. It's in the name itself, hand, foot and mouth disease, so it will obviously involve the palms and soles. Then you have R for Rocky Mountain spotted fever, and S for secondary syphilis. Remember, it's secondary syphilis. In the clinical manifestation of Orientia tsutsugamushi, apart from the non-specific symptoms such as fever, headache and myalgia, you also have a very classical triad. That is a eschar at the bite site. Then you have regional lymphadenopathy and rash. Another point to note is that the way the bacteria is being inoculated into the skin. Tick and mite, they bite and inoculate the bacteria into the skin. That way you can remember it. They're kind of rhyming. Tick and mite, they bite. Whereas in the case of louse and flea, they inoculate the bacteria when they're rubbed over abraded skin or mucosa. Coming finally to the treatment, we have the drug doxycycline, which is used to treat all the rickettsial infections. Not just that, doxycycline can also be used to treat almost all of the bacterial vector transmitted infections. The way I remember this is, vector helps the bacteria to travel a long way and then infect the host, right? Same way we have the word cycle in the word doxycycline, and cycle is a vehicle, it helps us to travel. So that's how I remember doxycycline is used to treat almost all vector transmitted bacterial infections. We have one exception, that is plague, which is caused by the bacteria Yersinia pestis. And the drug of choice for plague is streptomycin, whereas doxycycline can also be used. Doxycycline and gentamicin can be used, but the drug of choice is streptomycin. So hope this helped you guys. Thank you.